Okay, so just to finish this section for the day and before lunch, I'd like to introduce you to Carol Rothall, who works here at the Central Cancer Network and has come from a public health background. She's going to talk to us about the heat tool. She's got a lot to cover in half an hour, so I will be quiet and sit down and hand over to her.
Kia ora. Tēnā koutou. Ngā mihi nui kia koutou katoa. He mihi nui kia koutou ki te kaupapa o te rā, te kaupapa rawe te kaupapa motuhake he awhina atu, te atu koutou katoa. Ko Carol tōku ingoa, ko Taranaki taku maunga, ko Waitara taku awa, ko Tiati awa taku iwi, ko Manu Kōrehi taku hāpu. Tēnā koutou katoa. Kia ora everybody, my name's Carol Rothall. I am the equity manager. Aroha mai, I tend to wander when I talk. I'll stay still. For Central Cancer Network, I've been here just over 2 months now. Can you hear me all right? Kia ora. Central is awesome for me because I come from the centre of the universe, as I've just told you. So Central District is my buzz. My maunga is Taranaki, so I mihi to my whānau that are here today, kia ora. And that we're all whānau in this journey of cancer control. I am new to working within cancer. I come from public health. I did kōrero to Vanessa when she walked in the door today to say that I really like working in cancer because people are so nice, they're so patient, and I think I'm going to learn some of those lovely qualities throughout my journey because some of you that have worked with me in public health, and I won't look at anybody, know that sometimes it's been a battle for us in some fields, and so it's a pleasure to be able to work within an environment where you embrace the things that I am passionate about. And I mihi to all of our speakers, to Laura and to Maureen, firstly, to your kōrero about missingness, and I mihi also to our public health leaders and the work that we've done in decades of disparity, te rangahau hauora o Iru Pōmari, from hauora back all the way through to hauora 5 now, when Māori were dying to be counted, and if you're not counted, then you don't count. And if you don't count in this world of fiscal change, then the pūtea does not go to support you. So I mihi to that. Also to the cultural sensitivity, because I think that's something that each of our speakers have touched on, something that I'm going to talk to a little bit later as well. Rauawawa, to Rangi Mahora, Whaia Tiwai and Professor John, who's, we wish him travelling mercies on his way home. Some of the health literacy that you brought up, I want to speak to that a little bit later too, when I'm speaking about promoting equity for all of our whānau. More easier than difficult to follow. I think I'm going to be a bit more easy than difficult to follow, I hope, because I'm pretty sure a lot of you people here know quite a bit about what I'm going to talk about. I know from the passion that's in the room, the kōrero that's already been on the pai here, that we're all talking about the same things. We're all on the same waka, to tautoko all of our people, our tangata whenua, and our tangata tiriti, or our tangata tauiwi, under the korowai of and the principles of tiriti o Waitangi. So kia ora mai tātou. Also, I just wrote a few notes about our speakers. I thought it was neat, about the advocacy, the cultural supervision, about lifting your wairua, having to support each other. These things all really light my fire in the mahi that I have done and the mahi that I want to do here. My poi is ready. When I almost sang you the song from Pātea Māori Club, Poie, but the patu, the beating of my heart, the beating of my poi is here to add value to the work that I'm here to do. Ria and Vanessa, as I said, I spoke to Vanessa about the passion and the wonderful things that I'm already learning in my early times in this journey within cancer. And the P2P, it's true, it's prevention to palliative care. Vulnerable populations are all throughout that within cancer control. P2P, the pohiri to the puraporake, the beautiful sunset to the sunrise, and that lovely time in the middle where our wairua sits. All those things are really important to me and really important to all our peoples, wherever we come from. I'm ripped off anywhere you look because, I got kicked out of my land in Taranaki. I come from Waitara, so that's where the land war started. O Waimarae, where Maui Pōmari sits, our first medical officer of health. I whakapapa there. Also to Pariaka, got invaded, got kicked out, got sent down. No land, nowhere. My other background, and I know that Simon knows this, is Scottish and Irish, and we were kicked from land to land for stealing cattle and having nowhere to go, and so, you know, either way I don't have much, but whatever I have I'm here to give. So on that note, I'll push some buttons and move on to the kōrero of the day for me. Neat, eh? I'm going to introduce this tool. I don't have time to go through the intricacies of it. You're not going to leave here knowing how to use it if you don't already know how to use it, but it's about raising awareness. It's about that prevention approach to the protection, for me, under the Te Reti, is about the rights of all of our peoples to have equity and health outcomes throughout the continuum of their lives. So mihi to that. This year I've also been talking with Fiona Cram, who's done a lot of work with the Ministry of Health, with MSD now, with Whānau Water Tool as well. And so a lot of her work I am going to talk to. And she names her mahi turning up the heat. I'm just going to name mine turning on for the minute, just to ensure that, you know, that's where a start for me in this role as equity manager, is really to look at the tools that we use to achieve equitable outcomes for our people. I'm going to try and stick to the pages, but I never do that, so, and to the time, so we'll move on. Oh yeah, that's my overview. That's what is equity, what is inequity, what is the opposite of that. Talk about some tools in the heat, and some of the next steps that might be interesting for you guys, where the Central Cancer Network is moving with this mahi in particular, as it is weaved throughout the mahi that we do throughout Central Cancer Network. This basically means that doesn't matter who we are, where we come from, we should all get the same results throughout the determinants of health. Health, education, all of these things that are tools for us that help us to be rich citizens that give to the society. That's what equity should look like from my lens. We turn to one of our local people, Professor Don Matheson, who has been throughout the health system for a long time. He's a leader in equity, or promoting or reducing inequalities, reducing disparities. Equity as a word is the quality of being fair and non-biased. So health equity is the difference between populations that are unfair and unjust. It is unfair to have an imbalance in the outcomes of hauora, of health for our people. We've made those decisions throughout whatever, our own biases that we carry, ones that we inherited, we all have them, through the political decisions we make, through the political people we support. So there are other ways, and the work that we do and what lens we put to that. So there's lots of ways that we can actually turn that around to make outcomes better for our people. So what does it look like? You guys might have seen this before. I've seen this throughout public health for many, many years, back to when the research came out. It was first delivered, I think, to public health students in 2004 in University of Otago. And this clearly shows incidence versus access to health services. And you can see there, it's very, very clear, the representation of Māori, of incidence of ischemic heart disease, and their low access to those procedures that will prevent death. So this here is a pretty obvious picture of inequity, specifically in access to healthcare. In cancer specifically, we recently had this presented to us at the National Māori Cancer Leadership Group Hui, which is the inaugural Hui, from Diane Safati and Jason Gurney from University of Otago. If you look at the Māori statistics, I mean, they look pretty high, right? And overrepresented again. The scary thing about that, though, is if you actually put a linear line there, you can actually see that they're increasing. Sadly for our Pacifica, Tangata Pacifica, it appears that way also. And the inequity around this graph is if you compare that with the European and other, and if you make a linear line there, they're decreasing. So that again is inequity and something that we need to address. So what does it look like in cancer? Simple stats. Māori, 18% more likely to be diagnosed, but twice as likely to die. So there's issues there. Survival rates are lower. They shouldn't be, but they are. So the good evidence that at least some of this difference is due to our health service factors. But that's all right. Anybody recognise this photo? That's our little Rawiri and Goliath. And ka whawhai tonu mātou means that we will continue the struggle. We won't give up, because when we look at the inequities, it's like, oh, that's too much of a maunga to travel. It's too big for us. And this is about not being disheartened, is that we can, all that little bit of effort we put towards achieving equity for all of our people and all of our vulnerable populations. And of course, I also, when I think of vulnerable populations, I think of our children, our pepe, those sunrises that Ria talked about. So this is about, kia kaha, having the strength, knowing that we're going to continue and we're going to fight this and we're going to win, because Professor Don Matheson said in a generation we can beat equity, we can get it or beat inequity, aroha mai. So that's really encouraging. Lots of little rawaris out there. It's also about advocacy and perseverance, and this is Don Matheson's address to healthcare Aotearoa, specifically around primary healthcare, but about we need to keep that fight going. We've done a lot of good work in advocacy over the years in all areas. This is a really good one that I've done some work in, and it relates to cancer control, and that's about the amount of the advocacy, the henpecking, the not letting go of tobacco-related harm. And look what we've done in tobacco control. And we've been leaders within tobacco control, so that's a really encouraging thing. And that if we want to achieve equity, we still need that advocacy. We still need people out there waving the flag for that and not letting it go, not letting it be acceptable that even now, at this day and age, that we have numerator and denominator bias within our data set, so we can't compare, we can't get a true reflection of how many of us are actually dying. Chair, views from different mountaintops. This is, of course, the beautiful Maunga Taranaki. I put it first. You can see a few others in the background there. Tongariro, Ngārahoe, but they're little ones. Rupehu, oh, there you go. But this is really about that we all come, as I said before, with our different biases, our different backgrounds, our different opinions, the different strengths, the different taonga, whatever we bring. We all have value in that. We come from whānau, we all are valued and have valued positions within our families. So when we have that lens, we look a little bit differently at everything. But if one thing we can remember about that is when we look at something, we want it to be fair, we want it to be just, we want to achieve equity for all of our peoples and those visitors that keep coming to live in this wonderful place. Because look how beautiful it is. So that's something to be thinking about. So then we think about, we've all got different tools that we can use. There are several tools, and many more than those that are just here. I have seen these tools used throughout different areas of public health. I worked previously in injury prevention and trained practitioners to do planning and evaluation around intervention and programs and projects to reduce injury-related harm. The HEAT, or the Health Equity Assessment Tool, is a common thing they used. More recently, and alongside the intervention framework around where they might intervene throughout structural intermediary pathways, service delivery areas, to support preventing of injury. And the health impact assessment and whānau ora health impact assessment are also very useful tools in ensuring that the policies and programs that we're developing will actually enhance whānau ora or improve the health of our Māori and our whānau. So they can be used in different areas. Specifically, the HEAT tool was developed for mainstream. In planning, as I said, in planning from the very beginning, from needs analysis, what is the issue, which is the first couple of questions you will find in the HEAT. Who's used the HEAT here? Heaps of you, awesome. So you are the people that other people can go to for help to tautoko in the journey of using the HEAT tool, because it's a tool that is there to promote equity, to ensure that we haven't missed the gap, that when we go back and reassess our program or the projects we want to do, that we can go and improve it. Question 1 to 3 is about what is the issue, what is the problem, how did we get here, who's better privileged, and the questions through to question 7 are really about, okay, so how can we refine, define, improve what the project or the program or the policy that we have in order to ensure that whatever we're doing is making an impact on reducing inequalities in all of the areas of hauora that we touch. Similar to some of the models of hauora, it was intended for mainstream to improve the areas that they work specifically around the different population groups that may achieve less than equitable outcomes than our treaty partners. In particular, as I said, if you aren't counted, then you don't count. That's really important when it comes to planning and funding. If the numbers are too little, then there's less putia that goes towards those projects. So when you're making a picture of how bad the situation may be, it's really useful to have the HEAT tool to ensure that your analysis is correct as a quality control tool as well. Been used throughout, well, pretty much everybody and anybody can use it. And it doesn't have to be used in entirety. Some questions are more relevant than others. But the exciting thing is that it has been shown to help improve the equity of any policy program, intervention, practice, even part of the ethics involved with research programs or projects. It involves all of the evidence. So what we talked about today, all the evidence that we're gathering, we talked about the tōtara tree, and too many of our tōtaras, whaia tiwai, have fallen too young and too early, too soon. Paparangi Reid speaks, or she refuses to accept a world where by the right of their birth, her children will inherit a lifespan 10 years less than that of their treaty partner. And this is serious stuff. It means that Māori don't enjoy 10 years more of life than their treaty partner. So it's important that we consider those things. The community input is really important, the people's story, the qualitative data, the kōrero that Vanessa spoke to of the whānau, and those that worked with whānau throughout, with your vulnerable populations and throughout palliative care. You have those stories that can come and add so much value to the HEAT analysis of any of the work that you're looking to do in order to do one of the top 2 priorities of the New Zealand Cancer Control Strategy, He Koro Ai Oranga, and the New Zealand Health Strategy, which is to reduce inequalities. So kia ora to that. We know that he has a whakapapa. We can go back to mai rā way back to the 1800s and through now. There's lots of other things that impact on that people are too scared to talk about. The R words, like years ago, cancer, you didn't talk about that. You didn't talk about AIDS, and you didn't talk about racism. But all of these things have a whakapapa that contribute to the position that we're in now. So knowing that and learning that and understanding that, we can unravel that and get back to an even playing field, as Simon opened today, and that's what we're looking for. It's pretty obvious that going through this process sometimes with groups, it's really important to get your key stakeholders together, to get representatives of all of those groups that you want to, or your aim is to either improve the health outcomes, develop programs, projects, whichever area of hauora or any part of society that you touch. It's important that you get those people there so you've got an open, transparent, you've got all the information that you need, and you're going to have some challenges there. You're going to have, not disagree. We don't all have to agree. I think what we do have to agree on, what we have to take responsibility for and put our hand up and wave that flag is that, our commitment is to achieving equity for our people so that every child at the sunrise of their birth has the same chances to have a full, happy, loving life full of all the joys that we have all experienced or have the right to experience. So that's how I like to think of equity throughout the life years. Professor Don Matheson said that there is a fear throughout. There's like an international club for equity. Professor Michael Marmot has an institute towards reducing inequalities across the world. The Asia Pacific Health Gain, which is the Global Action for Health Equity, is a newer organisation. We have two representatives from New Zealand on that group, and you can follow the mahi that they're doing. It's really, really interesting, and that's Professor Don Matheson and Dr. Alison Blakelock. She was on there when she was in Health Promotion New Zealand. I'm not quite sure if she's still a member, but I'm pretty sure she would be within her new position. Some of the commitment that Central Cancer Network has, and this goes back to some of the discussions that we had, and it's around the cultural sensitivity, capability, all of those things. And also we're looking at targeting within the health system to assist those people that work with our Māori whānau, to help them work a little bit better with them, to understand from a Māori worldview where they could communicate better and look at getting better health outcomes or a better patient journey throughout that part of the process. So these workshops will be run from Palmerston North from September to August, and if you're on the email, we are able to email you. We can let you know when those are occurring, and they're going to be pretty exciting. Another thing that we're looking at doing, and that will be occurring in this half of the year, is we're going to turn up the heat. We're going to bring in some very skilled presenters that are used to working within equity promoting tools, within an equity promoting framework, in order to support people that all of your planning, whatever you're doing, whatever part of your mahi you're focusing on, you can add these tools to enhance the equitable outcomes for the people that you are there to serve. And some of you said you're a bit cold when you walked in here before, and I was hoping to turn up the heat a little bit with this kōrero today, but this is a little bit of going back to our past and celebrating our futures, because we have survived. I mean, back in, I think it was in 1896, there was in the New Zealand Herald, there was a piece, got it on my computer somewhere, that Māori were a dying race, and that this is where the smooth the pillow kōrero comes from, and that we can't do much about it, we just need to ease their pain. I mean, from our palliative care, where we weren't supposed to rise from that, we are survivors and we're still here. So that's really encouraging, and that we can achieve that equity, and we're trying to move up in those gains. We've narrowed the lifespan a little bit, so I think it's about 8 years now. So that's really positive, and we want to celebrate that. It is achievable. I'll blame Don. He said it was achievable within a generation. Is that 10 years, a generation? There you go. How many? 25. Oh, okay. It's a small time. So there you go. We've got 25 years. I guess it's like smoke-free to 2025. So we don't lack the resources, because I've got a whole lot of solutions sitting here today, and that's what's really encouraging. We have the tools that we can use. We have the knowledge. We have our tōtara tree that are still standing there that are there to awhi us our kaumātua. Our karawa and our kuia. We have our prized medical specialists. We have our academics, our researchers contributing to the body of knowledge throughout all the continuum of care, that we're going to get there one day. But it's about the will and the generosity of spirit. It's about actually not being despondent about it, not letting the Goliath get to you. It's about advocacy and perseverance, not giving up. Ka whawhai tōnu mātou, we will not give up the struggle. We want to see our people survive a lot longer. Unfortunately, when we looked at those, the heart disease versus the access to treatment, my father died when I was 21 of heart disease, waiting for a treatment that never came. So, I don't want other people to miss out on. I've lived more than half my life now, that's given away my age, without a father. So I don't want that to happen to other people. So that also strengthens my resolve, my will, and I have lots of spirit to be generous with. So on that note, I'll close there, but I will close with some of the opening words from Mihi Tushane, who opened for us so beautifully today. And these words are also come from Taranaki, from Tupuna Te Whitirongo Mai, who didn't give up, who didn't let his people die, through strategy, through care, through being clever. So we'll mihi to that with our other clever Māori in the room. Kia ora to the two ladies from Mary Potter Hospice. I thought that was really funny. He karoria ki te atua ki runga. He mata, he karoria ki ata ki runga, ki runga, I've forgotten it. He te mata o te whenua, he whakaro pai ki ngā tangata katoa aroha mai. What I tried to say there was, glory goes first to our Creator, and may there be peace on earth and goodwill amongst all mankind. Kia ora mai tātou. Oh, do we have questions?
Yeah.
Are there any questions? The other thing too is that our card is up there, and there's a couple of copies of whānau water impact which you can get off the Ministry of Health website, and also the heat. You can Google heat and it will pop up printed off, and they no longer post out hard copies of that. My card's there too, and if you do want to talk or have anything to add or information for us to share, please get a hold of us and contribute to that body of knowledge for all of our people. Kia ora mai tātou.
Can we just thank Carol again for that inspirational... you speak with such passion, and it's I think, what an amazing role that you have, just like the right person for the job, and inspirational. And it's heartening to hear after the way we started today, thinking about, you know, how far apart things may be, and now that we're going to lunch with all the possibilities that people have laid out before us. So thank you very much, and please go and enjoy your lunch.